I could not think of a single better image than this one by Baking Pancakes 21 on Redbubble to describe this next scenario of expulsion of intestinal gas. I farted in front of him, shame and methane. And that's what we're talking about for this scenario is shame and methane. So we have Frida who comes in for a relaxing spa massage, all right? It's her first time. She seems nervous. 20 minutes into the massage, she lets out gas and her body immediately tenses up. All right. She doesn't say anything at all, but her body will not relax. All right. Everything's become hypertonic, right? That's the term that we use when our muscles are extremely tense, more than what they should be. She is all frozen up. She is in isometric contraction everywhere. She's not moving, but she's totally tense. You see the sides of her face in the face cradle are blushing beet red, all right? This is arrhythmia when our skin is flushing, but this is of our face, right? So is it craniosacral arrhythmia? Is that what it is? Is it erubescence, right? Blushing. This can be caused by emotional stress. This can also be caused by social anxiety disorder, all right? So that's associated with facial coloration. When you've got social anxiety, you are prone to blushing frequently, and maybe she's actually scared of it. There's something called erythrophobia. That's a fear of blushing that's related to social situations. Absolutely understandable. But in this case, she's got a reason to be blushing. She has farted. She's already nervous about her massage. She's already scared about having someone touch her body for the first time. And now she is farting on the massage table. She's tensed up. What do you do as a massage therapist? Well, in this case, we always want to bring our client back into their body, okay? We want them to focus on what they're feeling. So we need to call attention to the fact that she's tensed up first and foremost and say, hey, Frida, I noticed that you're really tense. Is my pressure too much? What can I do to help you relax? Should we put you in another position? If she continues to do so, if she's too embarrassed to talk, you can bring up the farting. You can explain that you are relaxing her muscles on the outside. And if the external muscles are relaxed, guess what? If you're doing your job correctly, then the internal muscles are also going to be relaxed as well. All right. You don't need to get into the big words of parasympathetic nervous response. You can if you want to, because sometimes making it sound clinical and logical takes the embarrassing social emotional construct out of it. But if she doesn't respond to that, you can just let her know it's completely normal. In this particular case, you do need to focus on the client's personality. She may come from a societal or cultural background where farting, especially for females, is especially frowned upon. She might have, like we just discussed, general anxiety disorder or social anxiety disorder. She might just be generally embarrassed about body functions and very hyper-focused on herself and her image and her presence. And this may just be incredibly embarrassing for her. What you don't want to do is lose a client because she's so embarrassed. Because if you do not address the tensing, the blushing, the inability to now relax during the massage, she's going to be thinking about nothing else except for getting off of your table and getting out of the office. So this is the best opportunity you have to explain that this is a normal body response, that there's nothing to be embarrassed about. All it means is that you're doing your job correctly, and what happens in the massage room in this particular case stays in the massage room, and she's got nothing to worry about while she's in the office with you. This way, she's got a good potential to feel comfortable with you and return because she's done absolutely nothing wrong, and we want to get her to relax and enjoy the rest of her massage.